Next up, Susan Mullaney, President and CEO of Kaiser Permanente of Washington. Let's welcome her to the stage.
So what's on your mind?
I want to know what you think about how. I want to ask the easy question, and then I'll ask a little bit sort of different. How is the transition going from group health to Kaiser? But I'm really wondering, what are you learning about Washington State because of the group health legacy here that makes Kaiser Permanente of Washington maybe a little different than some of the other Kaiser states or other states where Kaiser has a footprint?
Well, first of all, I'll say the transition could not have gone better. So we're hitting all of our goals. We're improving convenience for our members. We're working hard on the affordability issue, and we'll bring a lot to the table on that front. And we're expanding and growing in membership and also adding new clinics up and down I-5 and throughout the state of Washington so we can be here for everybody. So I'm really proud of the work that Dr. Steve Tarnoff and I, our fabulous medical group, have done together so far. So, and a lot more to come. I would say I'm just so impressed that we as a state and we as healthcare leaders and leaders in the state actually get together and talk about the problems of healthcare, really listen to one another. I appreciated JT's remarks about keeping an open door and really listening to understand, because I think that that's what's needed. Mm-hmm. So we've got big challenges in healthcare, but we've got huge opportunity. We're at a transformational time, and I can talk about that. And I think it's going to be a matter, we're all smart people. If we stick together, we'll figure it out.
Yeah, but is there a legacy from group health that remains? I mean, Kaiser has a different model. I'm just wondering if there's a group health flavor in the Kaiser Permanente of Washington approach to care.
Yeah, the group health is an amazing organization. It's a legacy organization. And when I came on board and Steve and I worked together to transition from group health to Kaiser Permanente, we were really thoughtful. I was really thoughtful about, I want to really honor that legacy and that culture. Yeah. And welcome people into the Kaiser Permanente family. And the Kaiser Permanente culture is the sky's the limit. If we put our minds to it, we can figure out anything. There's no problem that's ever survived meeting us and our determination to solve it. Yeah. And that's the kind of culture that we're bringing into this new part of Kaiser Permanente in Washington.
Yeah. Well, I don't know everything. Obviously, I don't hear everybody, but from what I hear, the transition's gone really smoothly and well, and people feel pretty positive within Kaiser about that. So congratulations on the job well done.
Thank you.
Those aren't usually done very well, but it sounds like it's been going well there. Tell us about, you had mentioned this at Puget Sound Business Journal event as well. You just made reference to opening clinics up and down I-5, and I'm wondering if you could sort of tell us about that kind of vision for the Kaiser model throughout the central Puget Sound and really up and down that I-5 corridor.
Sure. So I should take a couple steps back. Kaiser Permanente is this country's largest integrated healthcare system. We've been around for 70 years. We'll be around for 70 plus more. And what makes us unique, what makes us tick, is when we know that we provide superior quality of care, value, and convenience for the members that we serve. If you are getting care from our providers in our clinics, using our integrated health record, our pharmacy team, our chronic disease management teams, and so that's our true north. We know who we are, we know how we provide value, and so the first phase of this, DJ, is growing the size of our medical group practice, growing our team. We added 400 people to our roster last year. Steve worked hard to add over 120 physicians last year with a lot more coming. And we're putting in our clinics and specialty care hubs up and down the I-5 corridor for two reasons. One is convenience really matters to people, and we want to be there for you when you need care. Our specialty care hub design is really unique. I've been asked so many times since I came to this market, when are you going to build a hospital? Are you going to buy a hospital? And I continue to say, the future of healthcare is not in hospitals. Done right, hospitals should be large ICUs. The future is actually shifting care to the left. We can do just about everything a hospital can do in a specialty care hub. I won't bore you with all the details today, but it's really cool.
Yeah.
And so we're going to be bringing these state-of-the-art specialty care hubs up and down the I-5 corridor so that you don't need a hospital. You can get world-class surgical care, medical care, emergency care in those hospitals.
Yeah. Wow.
But what I want to say, though, is I want to get back to, it is a transformational time in healthcare. And I think so frequently we focus on the negatives in this country, and the negatives in healthcare when I actually see a really bright future. So there are 3 big trends I see emerging that will really change things for everybody in this room, everybody in the state over the next 5 years. Precision medicine and genomics, big data, and technology. And so while we're working on some of the things that I just described, we're keeping our eye on that 3 to 5 year horizon time. So let me just briefly explain each one. Precision medicine and genomics. We're at an amazing time in the history of medicine. I see a fabulous physician who I know in the audience, and she's smiling because she knows this stuff better than I do. But for the first time, we could actually take you, DJ, sequence your DNA, come up with your genomic profile, say, okay, we know what kind of diseases that you're going to have later in life. And in our ability to predict that is getting greater and greater. So we can do that. That's only going to rapidly improve over the next 3 years. And with biotech and pharmaceuticals, it's a double-edged sword. We're going to be able to not just predict what's going to happen to you, prevent it, and then treat it early, which for you means you get to live a longer, healthier life. That's huge. Think about that right now. Breast cancer, ovarian cancer, we can predict with almost 100-degree certainty if you're going to have that or not. So we're all about preventing health. As a healthcare organization, we're motivated to keep you healthy, prevent disease, and then make sure you've got access to world-class providers and care when you need it if things go wrong. We're going to take that whole model to the whole next level. And I think that that's incredibly exciting. And that will also, I think that has the potential, if you look at radically intervening on the cancer rate in this country, you could save billions of dollars. And so we're set up uniquely to do that.
Tell me, what does that mean? How will you integrate, or how do you foresee integrating precision and personalized medicine into your standard commercial benefit that you sell to employers?
So we're set up to do just that because of our model. What do I mean by that? Very simplistically, there will be a time when it will be routine that your genomic profile is a part of your medical record. And then we will tailor all treatments according to your unique DNA, not on what we think might work. That will translate to a better care experience for you, longer, healthier life, and ultimately, too, it will translate to lower costs for healthcare.
So for people in our frontier West who have a libertarian streak, who say the last organization after the federal government that I want to give my genome to is a health plan, what would you say to that?
You know, we've got to work through all those critical details. Privacy, confidentiality, who has access to your data, huge issues. That won't stand in the way, though, of us eventually as a healthcare system in America and us as Kaiser Permanente getting to the place where we can use that really important information.
Yeah.
So, for instance, I don't know if anybody saw the headline news. This is incredibly important and exciting. 2 days ago, Britain's National Health Service made a big announcement. Every kid in England who's given a cancer diagnosis is going to have their genomic profile developed so they can benefit from precision medicine. So let's treat that child with something that's going to work for them and uniquely for them. And then they're going to study them longitudinally to understand how that intervention worked and how they can keep them well and healthy throughout life. I mean, it's here. Other countries are already doing this. We're uniquely set up to do those kind of things. The other two things relate to that. Big data. Imagine a time, DJ, I'll pick on you, that we're
It works
able
both
to,
ways.
okay, good,
Yeah,
right.
it's
And
okay.
I'll build a little bit on what JT was saying about the wearables. Ultimately, what determines your health is probably not what's going to happen in a doctor's office. It's today, what did you eat? What do you drink? How well do you sleep? How stressed out are you? If you take that, couple that with your genomic profile, that equates to your health, your quality of life, all of that. I believe there will ultimately be a day where all of your data on a day-to-day basis is aggregated. So it's kind of terrifying, but really cool at the same time, where you would know with accuracy, based on my individual behaviors and decisions, I'm either adding to the length of my life and quality of my life, or I'm detracting from it. I think we'll get there. I don't know that's going to be in the next 5 years, but we will get there, and that will dramatically impact individual health. It will also dramatically impact the cost of care in the country. Look at the rates of obesity that we face, right? It's huge.
Let me jump in to say that we happen to have the honor of hosting this Seroform style event in 13 markets. And I think we in Washington State are very lucky to have someone like you as a thought leader who's willing to say some of this stuff and push and actually implement. There's a lot of talk sometimes. I appreciate your thought leadership and your organizational leadership. So thank you very much. Let's give her a round of applause.
Thank you. Thanks,
Mullaney.
everybody.
Appreciate it.